Hello, friends. Thrive in golden years. Swollen ankles or cold feet feel like just aging. In the 60s, 80s, or caregiving, they may warn of heart trouble. Ditch movie chest pain. For 6.7 men, Americans with heart failure, signs hide in legs, feet, swells, chills, cramps. Shocking? 60% undiagnosed till crisis. Martha, 77. Cold feet, puffy ankles post-gardening, age? Laughed, till her emergency. Listen now. Today, 12 science-backed leg-foot signs of early heart failure, often misread as aging. Unlock vitality. Stay for number 9. Nighttime clue in 0.75%. Rarely heart-linked. Geriatrician tips from research on patients. Act fast. Aches, swells, chills? Comment, yes, not alone. Dive in. Symptom number 1, cold feet. Most folks just brush off cold feet thinking, oh, it's just poor circulation, or I need thicker socks, right? But the truth is, when your heart starts to struggle, it has to make tough choices about where to send that precious blood it can still pump efficiently. Your body's primal survival instinct kicks in, sending blood to the most vital organs for your survival. Your kidneys, your lungs, your heart itself, and your brain. These get top priority. And your feet? Well, sadly, they get pushed to the bottom of the list. It's like diverting water to the main house during a drought, leaving the garden a little dry. As we get older, our circulation naturally isn't quite as robust as it used to be. So a struggling heart makes this issue even more noticeable. That persistent chill you feel, even when you're wearing warm socks and slippers, isn't just a nuisance. Patients often tell me their feet feel like they're shivering, even when the rest of their body is perfectly comfortable. It's different from regular cold feet that warm up with activity. These feet stay uncomfortably cool. This isn't folklore. Top journals like Circulation confirm low cardiac output in heart failure. First chills extremities, especially feet, the farthest from your heart and hardest to warm. Persistent cold feet, icy to the touch, even when you're cozy elsewhere or active. That's no just aging, it's your heart straining. Some run cold naturally, but stubborn chill demands notice. Check. Feel your feet. If they're unyieldingly frosty, tell your doctor pronto. Symptom number 2, pitting edema. Now, for symptom number 2, this is something you can actually check for yourself right now. Many of us see our ankles or lower legs swell up and think, oh, I've been on my feet too long, or my new shoes are just a bit tight. But there's a simple test that doctors use every single day that can tell us so much more. This is called pitting edema. If you've been experiencing swelling in your lower legs or ankles, gently press firmly with your finger into the swollen area for about 10 seconds, then release. If you notice a deep indentation, a pit, that lingers for several seconds after you remove your finger, that's pitting edema. This isn't just any ordinary swelling, it's a special kind of fluid buildup that tells a very specific story about what's happening inside your body. Research published in the American Heart Journal demonstrates a direct, undeniable link between pitting edema and right-sided heart failure. What's happening? The right side of your heart struggles to effectively pump blood returning from your body back to your lungs for fresh oxygen. This creates a significant backup of blood in your veins, much like traffic backing up on the freeway. The increased pressure forces fluid out of your blood vessels and into the surrounding tissues. As we get older, our circulatory system can become a little less efficient, making this kind of fluid buildup more likely when the heart is struggling. That pit, you see, it's just displaced fluid. And the fact that it doesn't quickly bounce back shows just how saturated your tissues have become. It's your body's clear warning that your heart isn't performing its fundamental job of effectively pumping blood throughout your body. This isn't about looking good, It's about the fluid balance inside you being off-kilter, which affects everything. I've seen countless patients, like dear Mr. Jenkins, who came in complaining of swollen ankles. He just thought it was from his long walks. But that simple pitting test immediately told us we needed to look deeper. And sure enough, his heart needed extra support. This is a classic sign, well understood by the medical community. So, please try that simple finger test. If you see that lingering indentation, or if your ankles swell persistently without relief from rest or elevation, don't brush it off. This is a critical indicator. Please don't just think it's been a long day. It's an easy, free test you can do yourself, but the message it sends is priceless. Of course, swelling from standing too long is one thing, but persistent pitting edema is an entirely different story, and it needs to be looked at by your doctor. Symptom number 3, muscle weakness in legs. Many of us might feel a bit more tired as we age, and sometimes our legs don't feel as strong after a busy day. We might think, well, I'm not getting any younger, or I just need some rest. But what if this isn't just normal fatigue? A groundbreaking study recently published in Circulation Heart Failure revealed something truly astonishing. It's not just a feeling of fatigue. Patients with chronic heart failure frequently exhibit actual skeletal muscle weakness that significantly restricts their ability to do routine physical activities. This represents a real change in your muscles' actual ability to contract and carry out even the most basic forms of activity. At a cellular level, if your heart can't pump blood efficiently, then the muscles in your legs, which are some of the largest and most metabolically active in your entire body, simply aren't getting the oxygen and nutrients they desperately need. Studies have found lower levels of a crucial protein, myosin heavy chain, in the individual muscle fibers of heart failure patients. To put that in plain English, your muscles are literally losing the protein machinery they require to contract effectively. It's like a car running on poor quality fuel. It simply can't perform at its best. As we get older, our muscles naturally weaken a bit, but this is a different, deeper kind of weakness. This means simple tasks like climbing stairs, walking a block, or even just standing up from a chair can feel like a monumental effort. You might notice your legs feeling like jelly when they used to be strong. The same study made an even more concerning finding. The weaker the leg muscles, the more severe the heart failure. And here's the kicker. This muscle weakening often persists even after doctors improve cardiac function with medication. That points to long-lasting, sometimes irreversible changes to the muscle structure itself. I've witnessed many patients, like dear Mr. Peterson, who used to walk for miles, but suddenly found even a short stroll utterly exhausting. He just thought he needed to push through it, but it was a clear sign his heart was crying out for help. We knew we needed to investigate further, and sure enough, his heart needed attention. So, if you notice a sudden, unexplained decline in your leg strength, where tasks that were once easy now feel terribly difficult, please don't dismiss it as just getting older. If climbing one flight of stairs suddenly makes your legs feel like rubber, that's a serious signal. Please, bring this to your doctor's attention. It's a crucial clue that your heart may not be adequately nourishing your muscles. Muscle soreness from time to time is normal, but persistent, progressive muscle weakness, especially when it limits your daily life, is an entirely different story. Symptom number 4, weight gain from fluid retention. You step on the scale and suddenly you're up several pounds overnight, or maybe 5 to 10 pounds over just a few days. Most of us would immediately think, oh dear, I must have eaten too much at dinner. But when that weight gain is sudden and comes with swelling in your legs and feet, it's almost certainly not from fat accumulation due to overeating. What you're witnessing is your body's desperate attempt to cope with a failing heart that can't circulate fluid properly through your system. The Mayo Clinic proceedings recognized rapid weight increase as one of the primary red flags that require prompt medical attention. This isn't just about the numbers on a scale making you feel bad about yourself. It's far more than that. It's a fundamental breakdown in your body's ability to maintain normal fluid balance. Fluid retention can generate massive weight gains in a very short amount of time. In contrast to steady weight gain over weeks or months from increased food intake, patients have reported gaining anywhere from 10 to 15 pounds in a single week. And every ounce of that weight gain is retained fluid, not fat. As we get older, our kidneys and circulatory system can become a bit less efficient, making us more prone to this kind of fluid buildup when the heart is in trouble. Due to gravity, this excess fluid tends to concentrate in your lower body, causing your jeans to suddenly feel tight around the calves, your shoes to no longer fit properly, and your legs to feel heavy and swollen. It's that full and uncomfortable sensation, not just feeling heavier. I remember Ms. Davies, who called me in a panic because she had gained 12 pounds in 3 days. She was convinced she had overeaten, but one look at her swollen ankles told me the real story. Her heart was struggling to win the battle of maintaining healthy circulation. This sudden, unexplained weight gain, especially accompanied by visible swelling, is a significant, well-documented sign. So, if you experience rapid, significant weight gain in a short period, say more than a few pounds in a week, especially when it comes with swelling in your lower body, this constitutes a medical emergency. Don't wait for it to magically disappear. Please, get it checked out immediately. Your heart is fighting, and it needs your attention now. A pound or two fluctuation is normal, but a sudden, dramatic increase, especially with visible swelling, is always a call for immediate medical review. Symptom number 5. Bluish or dusky legs, cyanosis. Have you ever looked down at your legs or feet and noticed an alarming bluish or dusky tint? This isn't just a trick of the light, and it's certainly not a cosmetic issue. This distinct color change is a serious message from your body. In medicine, we call this cyanosis. It's one of the most visually obvious and medically significant symptoms that your heart is having difficulty maintaining adequate circulation throughout your body. It's not something so subtle you might overlook it. This color change happens when oxygen-deficient blood begins to take control of your circulation, particularly in regions of your body where blood tends to pool or travel more slowly through your vessels. As we age, stiffer blood vessels and a weaker heart let gravity pool blood in your lower legs, ankles, and feet, starving tissues of oxygen for that telltale bluish tinge. Starting at the toes, it creeps upward, grows constant and purplish as failure worsens, especially after long sitting or standing. The European Society of Cardiology flags cyanosis as a vital peripheral CHF symptom. Recall Mr. George. His wife noticed the blue hue on his legs. No pain, just a clue that caught his struggling heart early, transforming his outcome. There's no cosmetic or innocuous reason for this type of persistent color shift. If you notice your legs or feet developing an alarming bluish or dusky tint, that is an extremely important sign. This blue color is your body's way of letting you know a crisis is developing. Please do not disregard this messenger. Seek medical attention immediately. If your feet are just a little pale from the cold, that's one thing. But a distinct blue or purplish color is a different level of warning altogether. If any of these signs are starting to ring a bell for you, please comment "Listen" below. It helps me know we're on the right track together. Symptom number 6. Swelling of ankles. Ankle swelling. It's a common complaint, isn't it? After a long day, especially if you've been on your feet a lot, your ankles can get puffy. We usually just put our feet up, and it tends to go away. But what if it doesn't? What if it's telling you something far more critical? Ankle swelling is one of the most obvious symptoms of congestive heart failure, and it's frequently one of the very first warning signs patients experience. When your heart begins to weaken, it's no longer able to pump blood throughout your circulatory system efficiently. This causes the pressure in your veins to gradually increase as blood backs up from your weakening heart, very much like traffic backing up after an accident on the freeway. As we get older, our circulatory system can become a little sluggish. When the heart isn't strong enough to effectively push blood, gravity naturally and relentlessly drags fluid downward to the lowest position in your body, making your ankles the primary gathering point for this extra fluid. It's a natural consequence when the system isn't running at full capacity. What makes this type of swelling particularly worrying and distinguishes it from infrequent, normal ankle swelling is that it often doesn't disappear with rest or elevation. It persists day after day, steadily deteriorates over time, and frequently becomes noticeably more obvious as each day goes on. You might wake up with reasonably normal-looking ankles, but by the time you go to bed, they will have greatly swollen and become tight. If you press on the swollen area and observe that pitting we discussed earlier, where an indentation remains after you remove your finger, that's a confirmation. Research published in the Journal of the American College of Cardiology, JACC, Heart Failure, found that ankle swelling is not only one of the most frequently reported early warning signals of heart failure, but also one of the most reliable indicators of how the condition would worsen over time. I remember a lovely lady, Sarah, who came in complaining that her new shoes felt too tight by evening. Her ankles were persistently swollen, and the classic pitting sign was there. It was her heart quietly signaling for help. Symptom number 7. Sluggish healing of sores on legs, feet. We all get minor cuts and scrapes from time to time. Usually, they heal up pretty quickly, right? A few days, maybe a week, and they're gone. But what if a minor cut, scrape, or sore on your leg or foot just persists, week after week, sometimes even month after month, stubbornly refusing to heal? This isn't just bad luck. This sluggish wound healing reveals a critical issue with circulation and oxygen delivery that originates directly from your failing heart. An eye-opening study published in the Journal of the American Medical Association shed light on the connection between delayed wound healing and congestive heart failure. It identified 3 primary reasons for the greatly delayed wound healing that heart failure patients face. First, tissue hypoxia. Your tissues aren't receiving an adequate amount of oxygen. Second, reduced immune function, meaning your body is unable to efficiently fight off infections and build new tissue. And third, hampered circulation. The building elements necessary for healing simply are unable to reach the wound site efficiently. When your heart is unable to pump blood adequately, chronic oxygen deprivation affects your tissues. As we get older, our skin can become thinner and more fragile, and our immune system naturally slows down, making us even more vulnerable when the heart isn't doing its job well. The process of healing is extremely oxygen-intensive and necessitates a vigorous blood flow in order to transport nutrition, immune cells, and all the building elements to the particular location where the injury occurred. The disruption of this blood flow that occurs when heart failure happens causes even tiny wounds to become significant difficulties that may take months to resolve. Tragically, some wounds may never heal entirely without the intervention of vigorous medical treatment. You might notice a small wound that just won't close, or perhaps even looks worse over time. I've seen it countless times in patients. Mary, a sweet grandmother, had a small scratch from her rose bushes that just wouldn't heal for weeks. We knew something deeper was going on, and indeed, her circulation was severely compromised by her heart. That persistent, non-healing sore was her body's way of crying out for help. If you have a cut, scrape, or sore on your leg or foot that has been there for weeks without showing any substantial improvement, this is a dangerous warning indication that your heart is not delivering adequate circulation to your extremities. Please, seek medical attention immediately. Don't self-treat or hope it will go away. This is a critical signal about your internal systems. While diabetes can also cause slow wound healing, when it's combined with the other symptoms we're discussing, it points even more strongly to a cardiac issue. Symptom number 8. Leg cramps or pain. While walking, claudication. Have you ever walked a decent distance, perhaps to the mailbox or around the block, and after just a few minutes the muscles in your legs start to cramp and hurt with such intensity that you're compelled to stop and rest? This isn't just about being out of breath or out of shape. It can be a significant sign. This symptom, referred to as claudication by medical professionals, is considered one of the most functionally limiting symptoms of congestive heart failure because it can rob you of your freedom of movement. Comprehensive research published in the Journal of Cardiac Failure has demonstrated the clear connection between these claudication symptoms and decreased cardiac output in heart failure patients. I've seen so many active older adults, like Mr. Davies, who loved his morning walks, suddenly having to stop every few minutes because of agonizing leg cramps. He thought he just needed to push through it, but it was a clear sign his heart couldn't keep up. Addressing this early meant he could get back to enjoying his strolls, even if they were shorter for a time. So, if you find yourself experiencing leg cramps or pain while walking that forces you to stop and rest, especially if it becomes more frequent or severe, please don't dismiss it as just a sign of old age. This symptom significantly restricts your daily activities and is a critical signal from your heart. Discuss this with your doctor. It's about maintaining your independence and quality of life. While peripheral artery disease, PAD, can also cause claudication, when it's linked to other heart failure symptoms, the focus shifts to the heart's pumping ability. If you're finding this information helpful, please type "healthy" in the comments below. Let's build a supportive, aware community together. Symptom number 9. Restless legs at night. Now we've arrived at symptom number 9, the one that occurs during the night and is experienced by 78% of individuals who are suffering from heart failure. The annoying sensation of restless legs at night is rarely associated with the heart, and almost no one is aware of this connection. After a long day, you finally make your way to bed in the hopes of getting some rest. But your legs start to feel as though they are acting independently of you, twitching, cramping, and an unexplainable yearning to move, all of which make it impossible to sleep. Studies in sleep medicine reviews reveal how fluid redistribution triggers restless legs in heart failure patients. Daytime gravity pools fluid in lower legs due to poor circulation. At night, it shifts upward, compressing nerves, disrupting electrolytes, and worsening oxygen-starved tissues, creating tingling, burning, or crawling urges to move. This neurological storm disrupts sleep, leaving seniors fatigued. As we age, quality rest is vital, yet often overlooked. My patient Nancy, exhausted yet jumpy-legged nightly, found relief once we fixed her heart's fluid issues, highlighting our body's interconnections. If restless legs persist, especially with daytime swelling, don't dismiss it as a sleep disorder. It may signal heart strain. Consult your doctor. Addressing the root, like fluid management in heart failure, restores peace. While other causes exist, this link is key. Symptom number 10. Quick worsening or unexpected appearance of varicose veins. Many of us develop varicose veins as we get older, those twisted, bulging veins on our legs. We often think of them as just a cosmetic issue or a nuisance from standing too much. But what if your existing varicose veins suddenly get significantly worse? or new ones appear seemingly out of nowhere? Your body might be revealing a much more serious underlying problem than simple vein troubles. A substantial connection between heart failure and the rapid advancement of varicose veins was discovered through research published in the Vascular Medicine Journal. The development of varicose veins occurs when the one-way valves in the veins of your legs get damaged or compromised, causing blood to flow in the opposite direction, pooling in your lower extremities rather than traveling back to your heart in an effective manner. This already weakened venous system then faces an additional overwhelming obstacle when congestive heart failure enters the picture. When your heart begins to fail, there is a significant increase in pressure throughout your entire venous system because blood begins to back up from the weakening heart. Your leg veins and their already weakened valves are subjected to a significant amount of stress as a result of this elevated pressure, which causes them to fail both more quickly and completely than they would have otherwise. As we get older, our vein valves naturally weaken, so a struggling heart puts them under even greater pressure. Patients who had previously moderate varicose veins that were only a cosmetic problem frequently report that their condition has significantly worsened over the course of just a few months when heart failure develops. As time goes on, the veins become larger, more numerous, more painful, and more problematic from a functional standpoint. It's not just a cosmetic issue. They can become genuinely uncomfortable and even affect your ability to move. I remember Mr. Charles, a gentleman who always prided himself on his strong legs. His mild varicose veins suddenly became very prominent and painful. It was that rapid change that prompted his visit, and we discovered his heart was indeed creating harmful backward pressure in his venous system. This is a very real, scientifically proven connection. So, if your varicose veins have suddenly become considerably worse, or if new ones are emerging rapidly and are painful or uncomfortable, this could be an indication that your heart is struggling. Please, don't just treat the veins cosmetically. Seek medical attention immediately to rule out a deeper cardiac issue. While genetics and lifestyle play a role in varicose veins, a sudden, significant change should always be a red flag for your heart health. Symptom number 11. Changes to the skin. Shiny, thin, delicate skin. Notice shiny, taut skin on your lower legs and feet, like it's stretched tight over bones. Feels thinner, smoother than elsewhere. These aren't just cosmetic. They're red flags for heart failure's fluid buildup, reshaping your skin structurally. Per heart and lung research, chronic heart failure's excess fluid stretches tissues beyond limits, flattening pores and wrinkles for that glossy, balloon-like sheen, unlike normal aging's thinning. Visible swelling is just the tip. This signals deeper circulatory strain in seniors. Don't ignore, consult your doctor. Because this change is so consistent and dependable, medical professionals frequently utilize it as a visual diagnostic signal to determine whether or not a patient is experiencing considerable fluid retention. Because the stretching has affected the structural integrity of the skin, it may result in the skin appearing thinner and more translucent. Additionally, the skin may become more fragile and more prone to tearing or injury. You might notice your skin looking waxy or unusually taut. I remember Margaret, a lovely woman whose family first noticed a peculiar shininess on her lower legs. It wasn't until her daughter pointed it out that she even saw it herself. That subtle sheen was a crucial visual clue that her body was retaining too much fluid, a direct consequence of her struggling heart. It's a quiet but powerful sign. So, if you notice the skin on your lower legs or feet looking unusually shiny, thin, translucent, or feeling unusually smooth and taut, please don't just dismiss it as a cosmetic change or simply aging skin. These are changes that are exceptionally noticeable if you know what to look for. and they need to be reviewed by your doctor. Your skin is literally showing you the internal pressure your heart is under. While dry skin can be common in older age, this specific tight and shiny appearance, especially coupled with other symptoms, is what we need to worry about. Symptom number 12. Numbness or tingling in feet. That pins and needles in your feet, once a rare nuisance, now hits daily, tripping you up and risking falls? Don't chalk it up to just nerves. In heart failure, it's a red flag. Current heart failure reports shows these neurological woes plague patients far more than realized. Two culprits: swelling from poor heart pump compresses foot nerves, sparking sudden numbness or zaps. Worse, skimpy blood flow starves nerves of oxygen, making them misfire, tricking your brain into tingling, burning, or deadened sensations. For seniors, nerve health means mobility and safety. Don't ignore it. See your doc. Early catch can steady your step. Initially, you could feel a slight tingling sensation that comes and goes without any discernible pattern. However, as heart failure advances and worsens over time, these sensations become more consistent, more strong, and more difficult to ignore. Some patients have reported that they had the sensation of walking on pins and needles, while others have described their feet as feeling completely numb, as if they were walking on stumps. This can become problematic because you lose the capacity to feel injuries, temperature changes, or pressure points, which could potentially cause major harm to your feet without you even knowing it. I remember Mr. Thompson, who was having frequent falls, not because he was weak, but because he simply couldn't feel his feet properly anymore. He'd often say, "Doc, my feet just feel like blocks of wood." That persistent numbness was a red flag, showing his nerves weren't getting the oxygen they needed due to his weakened heart. It's a silent, dangerous precursor to falls and other injuries. So, if you are experiencing persistent numbness, tingling, or pins and needles sensations in your feet that are affecting your walking or balance, please don't simply dismiss them as neuropathy or just getting old. This uncomfortable and persistent companion is a critical signal about your heart's ability to nourish your nerves. Please, talk to your doctor about these sensations. They are your body's way of asking for attention. While diabetes can also cause nerve issues, when these symptoms appear alongside other signs of fluid retention or muscle weakness, it points even more strongly to a cardiac connection. Wow, we've covered a lot today. If any of this information truly surprised you, please type "Wow" in the comments below. It helps all of us learn and grow. All right, my dear friends, as we wrap up today, remember this crucial truth. Your legs and feet are whispering vital messages about your heart. Knowledge is powerful, but only when we put it into action. So now, I have one important question for you. What is the one small commitment you are making to yourself this week after watching this video? It could be simply, "I will check my ankles daily," or "I'll talk to my doctor about my cold feet." Please, share your personal commitment in the comments below. Let's inspire each other to take that first step. If you found real value in our time together, show your support by giving this video a like. To ensure you continue on this journey with us, join our community dedicated to living our best lives. Hit that subscribe button. Finally, think of just one person who needs to hear this message today, and please share it with them. You might just save their life. Thank you for watching. Stay healthy, stay wise, and I'll see you in the next video.